Hi, nurses. Welcome to Shift Change, the podcast for nurses who are ready to shift their thinking away from the just a nurse mentality and into claiming their position as powerful agents for change. I'm your host, Amy Deagle, Chief Nursing Officer and President of the International Network of Nurse Leaders. Our mission at the International Network of Nurse Leaders is to amplify the voice of nurses, inspire the new generation of nurse leaders, and lead a change revolution in the nursing profession. Everything we do is because we believe in the power of nurses to change the world. So let's get started. Hi, nurses. Welcome back to another episode of the Shift Change podcast. I'm so excited to be bringing you the interview with Mary Smith today. Mary Smith is the Executive Director of the Association of Registered Nurses of Manitoba. And we connected after the Not Just a Nurse Day that I held in October. And she is really passionate about professional associations and the importance of nurses belonging to professional associations so that we have a voice at the table. And I feel like it's a really timely conversation to be having, especially locally. We're facing the risk of staffing cuts, and nurses are feeling disengaged and disempowered. And so it's really important that we have this conversation about how we can get our voices heard, and professional associations is one of the ways to do that. I know there's a lot of confusion out there right now between colleges and regulatory bodies versus professional associations. So we are going to jump into that in the interview as well, and hopefully give you some clarity around that, because I know a lot of nurses struggle with knowing the difference of what each organization does. I'm also really excited to announce that I am going to be keynoting the Professional Development Day for the Association of Registered Nurses of Manitoba. It's going to be on April 8th in Winnipeg, Manitoba. And we are doing a play off of the Not Just a Nurse Day that the International Network of Nurse Leaders held in October. And it's going to be called I Am a Nurse. Find your position of power, pride, and leadership by joining your community of nurses for I Am a Nurse Day, a collection of provoking, interactive conversations that will empower and inspire you to consider what is possible on your path forward. So if you're interested in coming to that day, you can go to arnm.ca, and under the events tab, there is all the information. There is an early bird rate on right now. Even if you're not a member of the ARNM, you can still attend. There is a non-member rate. And Dr. Claire Becker, who is a former Shift Change podcast guest and current president of the Canadian Nurses Association, is also going to be there. So it's going to be an amazing day. So I really hope you can join us. And without further ado, I'm going to get to the interview with Mary Smith. So Mary has extensive experience in healthcare administration, leadership, research, education, policy, and clinical practice, with hands-on experience leading groups through complex change and empowering others in the achievement of a shared vision. Previously, Mary was assistant professor in the Department of Nursing at Brandon University. Prior to this, she held a variety of positions, such as Vice President, Programs and Services, Southern Health, Public Health Practice Leader, Women's Health Program Leader, and Client Services Manager for Healthy Living Programs. Mary's background also includes roles as Intervention Coordinator for the Manitoba Heart Health Program, Public Health Nurse in remote northern communities, and surgical intensive care nurse in large and urban center. She has a Master's of Nursing, Advanced Practice Leadership from the University of Victoria, and a Bachelor of Science in Nursing from the University of Western Ontario. And as I mentioned earlier, she is the current Executive Director for the Association of Registered Nurses of Manitoba. So Mary, welcome to the Shift Change podcast. I am so excited to have you here with us today.
Thank you so much, Amy. I'm really thrilled to be here as well.
So Mary, we just heard a little bit about your professional story through your bio, but I would love for you to walk us through your nursing career in your own words, what your journey's been, and some of those highlights that you've had along the way so far.
Okay, sounds great. Well, I guess it starts when I graduated from my Bachelor of Science in Nursing program at University of Western Ontario in 1978. I look in the mirror and I go, oh my gosh, who is that old lady? Because I certainly don't feel like I've been nursing for 40 plus years, but it certainly has been wonderful. And I did do grad school in 2000, got a master's of nursing and advanced practice leadership from the University of Victoria in 2009. So it's not like I went to grad school in my earlier time of my career. It was a little bit later. But it all started, I think it all started actually the fact that I was born and raised on an indigenous community, and my mom was the nurse and my dad worked for Indian Affairs. And I think that really impacted how I was socialized about community nursing, because I always, when I graduated, that was my goal, was to go up north to nurse. And it was funny because both my parents were not exactly that excited about me doing that. And I now kind of, after being up there and experiencing the challenges and the isolation and different things like that, I kind of know why. You know, nobody wants their kids maybe to have challenging times or things like that. But in the end, when they knew that that was something I wanted to do, they were extremely supportive. But first, before I went north, I knew that I really had to hone some of my skills and build confidence in my practice. So I left London and went into Toronto and worked in some critical care areas. And I found that that was really valuable to build, again, those skills and the confidence. And they say, you know, the first couple of years of your nursing practice are so important to be seen as foundational, not to assume that that's going to be where you're going to be for the rest of your life, but to really look at it as a way to consolidate what we just learned in school. So I applied to Health Canada for a position up north, had no idea half of the communities that were identified where all the vacancies were, and was offered a position up in Rayedzo, which is north of Yellowknife. So I went up as a public health nurse, and so it began. My love for the north, my love for the indigenous communities and the peoples, and the tremendous differences and diversity that I was not aware of, coming from a fairly big center in Ontario. And, you know, Ontario is sort of like a country in and of itself sometimes, because when I told people I was moving away, it's like, why would you leave Ontario? Like, why are you doing that? So I was first in Rayedzo, and then I had an opportunity again, because when you're in the north, there are opportunities that will come to you that you would never have if you were in the south, because there's not the number of nurses or people maybe that have the basic knowledge and skills to go into positions. So I was, after a couple of years there, was offered a nurse in charge position of a 2-nurse nursing station, which I look back and go, oh my gosh, you know, I was still very green in my, you know, when you think about the novice to expert theory, it's like, holy smokes, you know, learning constantly, sometimes feeling that imposter syndrome, like, what am I doing here? You know, why would they even have trusted me? But again, having the motivation and the passion for nursing to expand my horizons all the time was really important. And that was in the Eastern Arctic in Coral Harbor. And all of those communities are now have indigenous names that I couldn't even begin to pronounce very well. So I'm still using the English names. And then I moved on. I met my husband at the time. He was an airport manager. Then we moved to Yellowknife and had experience working in detox programs with people who are experiencing substance use issues, which was a tremendous opportunity to learn more about vulnerable populations and the social determinants of health. And had 2 children in Yellowknife, and then we were transferred to Whitehorse, where I then worked as an instructor at Yukon College with the Certified Nursing Assistant Program, which is probably our equivalent to LPNs here. And it also had the opportunity to build curriculum for community health reps, because up in the north, where there are some of the smaller communities where there is no stationed nurse at that time, these community health reps acted as the liaison between the nurse that was maybe in a nursing station a flight away or something like that. So that was a wonderful experience. So I spent most of my time up in the north, and then moved down in the early 90s to Portage Prairie. There was airports across the country were starting to be privatized, and governments were no longer running airports. So we were transferred to an airport down in Portage when they were changing over the Air Force bases. And that's where I started doing a position with the Manitoba Heart Health Project. So that was my first experience with research. And it was my role was intervention coordinator. So I was to collaborate and work with community committees to identify what their needs were as far as primary prevention and heart health. And I often say to this day that was the beginning kind of almost like graduate work, because working in a research project with doctors and PhD prepared individuals, learning about change theory, behavior change, all of those things was absolutely amazing. So there's so much that goes behind the development of an intervention, right? It's basically our nursing process, but was put at a very broad scale with communities. So that was wonderful. Unfortunately, the funding wasn't renewed after the period of time. However, I had an opportunity to take on a director of public health position. The advantage to that was that I was able to help build and establish a program that was basically mirrored after the Heart Health Project, and had still having our healthy living facilitators and public health nurses engaged with communities to identify what their needs are, what do they want, what do they need in order to take responsibility for their own health. So after that position, a senior leadership position became open on our senior executive team, whereby I was in charge of a geographic region of our region. So being a rural RHA, our geography was very, very big. And so within that portfolio, I had everything that was located there, from acute care, long-term care, all of the community programs. And it was a wonderful opportunity for me to, again, kind of go back to my original roots of critical care or acute care, and then look at it across the continuum and help identify where are there needs to help ideally shift resources and where the needs are, that whole opportunity to put the lens of a community assessment towards work that's happening in the hospital as well. Then after that, I saw the need to maybe retire. Well, that was very short-lived. It was only for 6 months. And there was an opportunity, a position at Brandon University to teach nursing. And that was basically a long-term goal I had when I graduated from university, because I had some wonderful mentors and coaches who were university professors of mine that I admired greatly. And I thought, someday I would love to do that, but never, ever believed in myself or thought that I would get there. And I thought, oh my goodness, here's an opportunity. And those positions don't always come across very, very much. I mean, Brandon is a university that is focused on rural nursing, or the program was focused on rural nursing, which was something I believe in very strongly. So I spent 4 years there, and then had just some changes in my personal life that warranted my desire to move into Winnipeg. But I knew that I wasn't just going to move just for any job. I was waiting for the right job to come across. And when this position as executive director of the Professional Nursing Association in Manitoba became open, it was like, oh my God, that's the job. Because what it's done is allowed me to basically, like all the jobs leading up to this job has been like stepping stones, providing me with just the lived experience to, again, have an awareness of what the context of the various areas are, having been able to work in research then, in education, clinical practice, community development, all of those things have really been very valuable in this job that I'm currently in. So I feel very, very lucky about that.
That is an amazing career story. And I love how it highlights just all the opportunities that we really do have available to us as nurses and how many different avenues that we can do all under that one title. I don't know that there's another profession or career out there that has as many possibilities that nursing allows.
And one of the things that I think is really helpful for those, as we enter into nursing, we're often motivated by just how challenging it is, right? And I think we all have to step back and sort of say, what, we're really lucky and quite blessed to be able to work in this profession. I was going to be a math teacher.
Oh, really?
But I changed my mind. Yes, I changed my mind in grade 13. Ontario had grade 13 at the time, after I had back surgery in my last year of high school. So there was a student nurse who was assigned to me, and she had an amazing impact on me, and it changed my mind. I thought I wanted to do and be what she did for me. I honestly can't really remember that much of what she did, but I certainly remember how she made me feel. And I think that's something that's so important for us to remember. And it's funny because my mom, as I mentioned, was a nurse. And I really think that she always thought that it was her that mentored me into changing my mind. And of course, didn't have the heart to tell her otherwise.
Yeah. It would be interesting to know how many nurses, especially out there listening to the podcast right now, became nurses because a nurse had an impact on their life, and whether or not they remember what exactly that nurse did for them, or like you said, it was the way they made them feel that had that lifelong lasting impact. It would be interesting to know that. Yeah.
It really would. Well, I was just going to say that I do have a regret that I never told that student nurse how much her care and compassion meant to me, because as nursing students, you always feel like, oh my gosh, you're not maybe having the confidence and things like that. But I wished I would have had that opportunity to tell her that.
Yeah. We, even as colleagues, we don't tend to shout out each other and show appreciation as often as we should. So that's a good takeaway for everybody listening too.
Exactly.
When you see somebody doing that, call it out, because it is a tough job at times, and just we have no idea how impactful just that appreciation and recognition can be in one person's life. So yeah, that's a really good lesson.
Exactly.
So Mary, one of the things you mentioned was your struggle with imposter syndrome, when you took on this new role. And I think that's something that a lot of nurses deal with, especially as we move up into official management and leadership roles. We have this struggle going on internally. Can you just touch a little bit on how you dealt with that and how you would advise nurses that are maybe struggling with that a bit on how they should be dealing with it?
Sure. I think it's one of those things that's very normal. That was the one thing to understand is like, it's normal to feel that way, especially with every job change. So it doesn't matter whether, I was doing a job change after 25 years. It almost it slips you back to that feeling of like, oh my gosh, and there's so much wonderful literature in our nursing body of knowledge that speaks to the importance of preparing ourselves and having awareness of those changes so that the stress does not impact us or sort of like hit us in the face like, oh my God. But if you're prepared, and then just that, as I said, recognizing that it's normal and it's okay. It's okay to feel that way. But part of that is what stimulates and motivates you to learn more. When I was working with students, and even in this position, when I go and present on the association to student nurses, I first start by congratulating them for choosing the best profession in the world, that they are going to have endless opportunities that they will never get, and not to be afraid to go to those places where you are uncomfortable, because that's where the learning is going to happen. It's just like, when we do endurance work, in order to build muscle, you have to stress it. And that's where the change and the positive growth is going to happen. So it's a challenging time, and nobody likes to feel like they're like, oh my gosh, what am I doing here? How do they trust me to take on this job? But it's normal. And in many ways, you need that, because if you're overconfident and then you think you know everything, that can work, can work not in your favor as well, right?
Yeah. Yeah, and I love that. I think the only way to get over that imposter syndrome is to just do it. And it builds confidence as you take those steps and really just dig in and learn. And if you come from that beginner's mindset and the curiosity of, okay, I don't know everything yet in this role, but I'm willing to learn, it just opens you up to so many more experiences. And yeah, I love that takeaway.
Yeah. The other thing I was going to add, Amy, if you don't mind, is that it gives you also the opportunity to be a really good active listener when you're first learning about a role or learning how to work with your team members, because it's always important to recognize with that imposter syndrome that you have a lot to learn and that you have a lot to learn from others. So then marrying that with the fact that you are bringing a lot to the table as well. So there's that half and half perspective where you have a lot to learn, but you're also bringing a tremendous background from our knowledge base as nurses and from our experiences.
Yes. Yeah, I agree. And I mean, the part you mentioned too with rural and remote nursing, like as the listeners who've listened to a podcast episode know before, I'm a huge advocate for rural nursing. And I feel like your skills just grow exponentially when you're put into those situations out there where you are kind of the only person out there or have a very small team. And same with travel nursing too. I did travel nursing to rural and remote communities as well. And so you learn to have that trust in yourself and your ability to figure things out. And I think that's a huge part of developing that skill set as a leader, is finding that internal confidence that you might not know the answer, but you know how to figure it out and you will find it out. So I think that's another big piece.
Yeah, for sure. Absolutely. And it also speaks to the importance of that connection and establishing the relationships with your intra-professional and interprofessional colleagues, because nursing is a team sport, right? Like we may work independent, like individually or whatever, but we're also part of that team. And I think that, there's a lot of focus now on the interprofessional collaborative framework that there's a Canadian framework on interprofessional collaboration that many nurse regulators and health organizations have adopted that really stresses the importance of collective competency, so that in order to have safe, quality patient care, the team has to be confident. So not just the individual team members, but the collective confidence. And I just find that really interesting. But when you look back at when teams are functioning really well and things are going well on a unit or a program, you really can see how that makes sense.
Yes, absolutely. And that's a really great point, because I think it's a really hot topic right now. Unfortunately, there's a lot of fear around increasing scopes of practices in certain nursing professions and where does that leave us? And I just keep wanting to echo, there's room for everybody. If we stopped being so fear-based around, the LPN's scope of practice increasing into the RNs and the RNs into the NPs, into the, family doctors, like there's room for everybody. If we look at the healthcare system and shook it up a little bit and reimagined how care was delivered, there is room for everybody and nobody has to be worried about, stepping on toes or that we're not going to have jobs, because there is so much work to be done.
So much work.
And so many
work for everybody.
Yes. And so many challenges still to solve, that if we came together and work collectively towards solving them instead of trying to, stake out our territory. So I love that we're, having those conversations now at higher levels, because I really feel that that's where the nursing profession needs to go, is having a look as a whole profession and how do we work together to solve some of these health challenges.
Yeah, I agree. I think of a story my mom told me when I was in school. When she was in training, the physicians were lobbying against nurses doing blood pressures because that was encroaching on their scope. So it's so interesting on how, like, historically, we're sort of repeating the same thing, and sometimes we're not learning that there is, as you say, Amy, so much work out there, and everyone's bringing their unique body of knowledge and skill set to the table. And it's okay. There is going to be overlapping scope. That's going to be the reality. So if we accept that reality, but recognize, but this is where we fill the gap.
Yeah.
This is where have that extra expertise. It just lets that wheel turn so much easier if all the spokes are working together.
Yeah, I agree. And I love that, the Canadian Nurses Association opened up their membership to all professions of nursing. And I just think it's so important to have that federal voice as one, nursing body. And I know with being the executive director for the Manitoba Association that, you guys are moving in a similar direction. Is that correct?
That's right. At our AGM on April the 8th, there will be a submission to the members about bylaw changes that we would be opening up our membership, our practicing category membership, to all regulated nurses. So that a potential name change would be the Association of Regulated Nurses of Manitoba. Some advantages there is that we would be able to be only changing one word in our title, so there's cost savings related to logos and different things like that, because as a voluntary organization, our revenue comes from our members.
Yeah.
And we take that very, very seriously, that every penny spent is useful and is going to provide value to the members. And but we are so excited about the opportunity to represent nurses. And I often say when I'm talking with our colleagues, LPNs and RPNs, licensed practical nurses and registered psychiatric nurses, most of our professional development and our advocacy work relates to the nursing discipline, not one category of regulated nurse, right?
Yeah.
So it just makes so much sense. Now, the history of why we started off as a registered nurse is that our college had put out a call to all of us to say we can no longer do association type work. Our new Regulated Health Professions Act that was struck by the government said colleges had to be strictly regulatory. So that's why it started, because the registered psychiatric nurses are just in the process of coming under the RHPA, they call it, and then licensed practical nurses will be after. So it wasn't at all an attempt to segregate or isolate RNs from the others. It was merely logistic and related to the government legislation, but very excited to work together. We're going to be stronger and better together.
Exactly. Yeah. I love that. And I think that mentality is starting to grow across Canada anyway. So I'm really excited for what the future holds. I love that you brought up the college and the association and kind of the regulatory body. I have to admit, I didn't know the difference between the college and the association, even as a provincial counselor of my provincial body. It was my first day at the orientation meeting, and somebody sat me down and said, well, this is actually, there's two separate streams here, and this is really what you're here for. And I was like, oh, so could you take a moment and just explain to our listeners what the difference between the regulatory body, the association, and also just the union? Because I think a lot of people assume that the association and the union are the same pieces as well, and they're three very distinct, different bodies.
Exactly. And I think you bring up a good point, because there is confusion out there in the nursing landscape about what the mandate of the various organizations are. And so we always start our presentations when we're out with students or even our membership to help frame that. So I have a PowerPoint. One of the slides is 4 concentric circles, like the Venn diagram, that has a little bit of overlap of each, because there are going to be issues that each will deal with, but from a different lens. So I say 4 because we include our educational institutions as being part of the nursing landscape, because, as you know, nobody can apply for a license or registration with a college to become a nurse unless you've been from an approved educational program. Right. So they play a key role because they are building and developing our future workforce. So they exist to educate future nurses. And then the regulatory body, because once you graduate, you then will apply to, in Manitoba, we now call it a certificate of practice. So that's what our Regulated Health Professions Act kind of calls our license. And they exist to protect the public through quality nursing regulation. So they identify the entry-level competencies that are required by educational institutions. They approve educational institutions. They identify our scope of practice, practice standards, like practice direction, so that they are saying so that the public knows that if somebody calls themselves a nurse, a registered nurse for whatever college they're from, they are meeting a high level of a high standard. And so that's why within our colleges, there are complaint and investigations, because if a public member felt that that standard wasn't met, they need to address that. So it's quality practice is what they are mandated to do to protect the public. Mm-hmm. Then, as most nurses, when they first graduate from school, they may or may not go into a unionized environment. But if you're like myself, wanting to sort of amalgamate and consolidate your nursing skills, often nurses are going into direct care. Not all, but most facilities, acute care facilities, long-term care facilities are unionized. And the union is there to protect the rights of the nurse in the workplace, that employer-employee relationship at that front level. So their mandate is working with that collective agreement between the employer and the union for, just that working environment. Then the association, the professional association. So we've only been in existence in Manitoba going on our 4th year. So it is understandable why many nurses aren't quite sure of what we are yet, but we exist to provide that professional nursing voice to advance the profession and influence healthy public policy. So it's so important for us to develop really credible, effective relationships with stakeholders who are making decisions about healthcare, who are making decisions that are impacting nursing and the nursing discipline. Because I've worked most of my career in community health, I think of the analogy of population health versus individual health. I see the professional associations at that kind of population health level. It's not that we're not cognizant and concerned about that individual nurse and the issues they're dealing with in their day-to-day, but we look at that from the lens of the profession, of the discipline. Does that help?
Mm-hmm. Yeah. And I think, just that differentiation of the regulatory body is really there for protection of the public. And I had a nurse like, well, then why do I need to pay money to protect the public? Like, why do I pay money to get a license? And somebody said, well, it's like how we pay a license to drive a car. For the right to drive a car, the insurance, all of that sort of stuff, we pay for that right. We pay for the right to practice nursing as the most trusted profession in the world.
That's a really good example.
Yeah. Mm-hmm. And we have to have those regulations to keep that title and keep the trust. Mm-hmm.
Absolutely. And, the criteria for a profession, there's definitely strict criteria, like being self-regulated, and that is a privilege.
Yes.
If we weren't perceived as, or if the college wasn't perceived as doing their job to protect the public, that self-regulation can be removed. And so we as members, and being self-regulated, have to support that. And we have our own code of ethics, which is part of the criteria of being a profession. We're not a job or sometimes even a career. The difference between a career and a profession, it puts us at a different, in a different category per se. So it is, as you say, and using the example of a driver's license is really good, because we'll say, well, what do we get from here, the Manitoba public insurance? Well, we get a license to be able to drive, and we need to pay money to help support, having the laws and the signs on the roads and all that kind of stuff. So, yeah.
And so then, a lot of across Canada anyway, a lot of our dual mandated college and associations have now separated. And so those nurses out there that are asking, well, what does the regulatory body do for me?
Yeah.
that's your right to practice. It's a protection of the public. The association is what your voice is. And that is the organization that's really advocating for nurses and is our voice in our provincial bodies, but also then, at the federal level through someone like the Canadian Nurses Association. And I think, with the separation between colleges and associations across the country and associations moving to a voluntary basis, I'm really concerned that we're going to lose some of that powerful nursing association voice that we've had because people don't understand how important it is to still be supporting those associations. So as the executive director of one, can you tell us a bit about what the association does and what those membership benefits are and just why it's so important for nurses to sign up and be part of that group, to really make sure that they do have a voice?
Yeah, that you really hit the nail on the head when you said that the need to demonstrate the value and have nurses understand and internalize that. Because when you are a voluntary organization, you don't have the comfort of knowing what your budget is going to be from year to year. Having the revenue primarily from your member base is a challenge. And many nurses that we interact with, we are very fortunate that we have approximately 77% of Manitoba nurses as our members, registered nurses, out of over 11,000. So that is when we do a comparative, that is a great percentage, but it's not good enough. I really believe that being a part of your professional association is a professional responsibility. And the fact that it's voluntary is a challenge, but it also says it's an outward and visible sign to say, I support nursing. I support my discipline. Because if you don't, then say the 77% of the nurses that are supporting us are the other people that aren't. They're getting the benefit of it because of the work that we do. And that's really not fair. Our focus is on that advocacy, the professional voice. So we're always out there seeking opportunities to be at decision-making tables, to work with groups that are making changes or doing things that will impact the nursing workforce and different things like that. Very much focused on promoting professionalism, professional development, because we know that we are a discipline that is required to have lifelong learning. We've got continuing competency expectations from our regulatory bodies, and which is fabulous because we know, just as we've talked about earlier, there's always the need to grow, especially in healthcare. That's the one thing that's constant, is that it's always going to be changing. The other area is leadership, promoting nurses as leaders. And as with your networking, you have been so good about saying every nurse is a leader and has a role to play and has to embrace that and not just expect that it's only in the formal leaders that are going to be the lead, take on leadership responsibilities. The other focus we have is promoting nursing excellence. And I think one of the best ways that we've been doing that recently is developing collaborative partnerships with our specialty groups. We have over 40 specialty groups of nursing because we're such a broad discipline with so many settings that as nurses have increased years in an area, they want to specialize, and it's wonderful. So their mandates are very similar to ours, is to promote and advocate for their practice area. So we're really excited about the collaboration that's happening. And the advantage to that is that the nurse member out there can see how we're aligning with those specialty groups that have been around for a lot longer than we have. We don't want to be siloed. I know a conversation I had once with a politician in the community. He was just saying nursing just seems really siloed. There's these groups and that group. This one's coming to talk to me about this, and this one's what he goes. Can't you guys kind of just have one group? And it was really, and this was before our mandate with our college was separated. So it really always rung true to me is we've got just what you were saying. We're going to be stronger. working together, and that's the way that we should be moving. So with the other thing, aside from the professional benefits that your professional association will bring, we have the opportunity to give members wonderful like financial discounts and discounts like on online shopping, discounts on memberships to things. So I'm always saying you can, if money is an issue, which it always is, and that's understandable. I love it. I'm very frugal and watch my money as much as the next person, but you can get your money back by virtue of accessing the discounts that we have with the association. I have grandchildren in Alberta and I fly WestJet every couple of months, and I've already recouped my membership fee just through our WestJet discount.
That's amazing.
So it's like, yeah, and we have a group rate for our liability protection. So part of our issue, and it's our challenge, is to get out there, engage with our members so that they understand, that they can make an informed choice about whether they would like to be a member of ours or not. I think once, and we found that even if we get an opportunity for them to call us to talk about it, we often have them as a member. Mm-hmm. But if people don't engage to find out, and I think that's important in nurses, like when we think of our nursing process, we always have to assess and then make the decision on what we're going to do. That's what happens is that people are looking maybe just at the bottom line and of the dollar and don't realize what they can get in return. And the big thing again is just that opportunity to be part of your nursing profession, to show and exhibit the strength in numbers. Because when we go to various political tables and things like that, we will often be asked how many members we have. Mm-hmm. They want to know. And that's why we're proud of the number that we have, because that's significant. And it goes, oh, okay. And we also say that by having your professional association attending these committees or being part of these tables, we can bring and connect those decision makers to subject matter experts, because we have such a broad membership base with the various specialty groups, whatever. So if they're talking about an issue that relates to whether it be acute care or personal care or within the community, we can bring those subject matter experts to assist them, because nursing has tremendous evidence and we need to use that evidence. And I know it's sometimes really tough to find what evidence is going to click or trigger the reaction we hope, but that doesn't stop us. We always, everything in any approach or issue, I think we have to look at things from a multi-level, multi-strategy position, because there's never going to be just one way that it's going to work.
Yeah, I agree. And there's a great quote by Stephen Lewis that says, with the nursing profession in mind, so many voices, so little voice. And, there are a ton of nurses out there. We each have our own voice, but it's really through these professional associations that our voice is being heard at these policy tables and government tables. And that's why it's so important, because if we didn't have that direct route in, we were kind of lost in all the noise. Nurses, it's time for us to recognize the power and take pride in what we are, nurses. On April 8th, 2020, find your position of power, pride, and leadership by joining your community of nurses for I Am a Nurse Day, a collection of provoking, interactive conversations with nurse leaders and compelling Manitoba nursing professionals that will empower you as a nurse and inspire you to consider what is possible on your path forward. We need to eliminate the just a nurse mentality and replace it proudly with I am a nurse. This day will reconnect you with your why. This day is designed to reconnect you with your why you decided to become a nurse in the first place, and to rekindle your pride and your commitment to our chosen profession. This day will remind you that the design of your own unique nursing career is up to you. And this day will elevate your idea of what is possible within the industry and inspire you to start putting your big ideas out there. It's time for us to lead the profession into the future stronger and healthier than ever before. I am so excited to announce that I am going to be a keynote speaker at the I Am a Nurse Day in Winnipeg, Manitoba on April 8th, and I'm really hoping that you can join us. If you go to arnm.ca, you can find all of the information there to register. You don't have to be a member of the Association of Registered Nurses of Manitoba to attend. Anybody can come. There are non-member rates, but if you are a member, please act fast because there is an amazing early bird discount rate that you can get in on. And if you are located outside of Winnipeg, but you still want to participate in this day, you can consider hosting an I Am a Nurse Day satellite site. And if you're interested in this option, you can find all the information on how to connect with the ARNM on their website. So again, April 8th, 2020, I Am a Nurse Day. I'm so excited to be there keynoting, and I hope to meet you if you are able to attend. And again, just visit arnm.ca for all the details. So I want to shift gears a little bit here, Mary, because I want to talk about 2020, and it has been designated by the World Health Organization as Year of the Nurse and the Midwife. So what changes would you like to see the nursing profession make this year? You know, there's a lot of momentum and excitement, and this is really our year to do something. And, you know, I know that your association is really trying to honor the year as well. So are there certain things that you would like to see the nursing profession do this year to really draw attention to the importance of nurses?
Absolutely. You know, we are so lucky that in our lifetime, we are experiencing this declaration because it's really a once in a generation or once in a lifetime opportunity, because that Nursing Now campaign has been developed, you know, with our International Council of Nursing and the World Health Organization. So it's not just a mere like, oh, we're going to declare this. It's a big deal. It's pretty amazing. And their goal is to improve health globally. So it's definitely a big challenge. And to raise the profile and status of nursing. I just absolutely love that because they recognize that nursing has a really, really important role to play in healthcare. And we've been overshadowed. And as you say, the voice has been weakened, and it's time for us to do that. So I think one of the things the question related to the challenges or what we're hoping to accomplish.
Yep.
Okay, so one of the things we're provincially hoping to accomplish is we're starting off by bringing together the regulated nurses to develop a plan for the whole year so that it's not just the association's plan, but we are going to be a lead agency in working together, but again, using those community development principles to bring everybody together, bring all the voices together for nursing, and have that unified approach to improving and inspiring nurses, improving sort of, I think, that self-image that sometimes we have about that just a nurse. And that's one of the goals and one of the challenges of our upcoming Professional Development Day, that we're so excited that we're actually working with you, Amy, and have almost jumped off of your day that you had, the Not Just a Nurse Day, and we're coining it the I Am a Nurse with the just crossed out.
Yes, I love it.
So that we can, it's going to be amazing. And we're so excited to have you come and be our keynote for that day, because it, again, just shows how the variety of, we're so unique in our diversity, because there is so much skill out there, so much knowledge that we can learn from each other. And so that's going to be one of our big highlights, and we're going to be also having a celebration of excellence, of nursing excellence. And because it's the Year of the Nurse and Midwife, we're very excited about partnering with our Midwife Association. So we've recently requested from our provincial government if they would declare provincially the Year of the Nursing Midwife. And we're very excited to say that they've wholeheartedly agreed, and we were able to have a meeting with our Deputy Minister of Health, with my colleague, the Executive Director of the Midwife, and we'll be working on doing a photo op and bringing key nursing leaders across the various organizations to have a photo opportunity. So we really are wanting to launch this year collaboratively and collectively. So it's not just, again, getting out of the silo perspective. Mm-hmm. The other thing that I think is going to be a challenge is the context on which the year is happening. We are very aware, I sometimes am accused of being a bit too optimistic, but I'm not naive and that I don't understand the challenges that our workforce has right now. There's a lot of burnout, there's a lot of change fatigue, and with that, we have that challenge of how do we get nurses engaged to be part of this? And we really want them to recognize that if they were to come to that professional development day, and that's just going to be one of the activities throughout the year, but that's going to be a day that's going to be about them, about celebrating the fact that we're nurses and that we're proud of being nurses. And we have such an important role to play, and the importance of us sharing that role as much as possible, and having, people like you who are going to speak to even your journey in starting the international network. That's absolutely, it's amazing, and you deserve so much credit for doing that. And sharing those stories, I think, will be so inspirational to other nurses that may have an idea or would like to do something similar to get out of their comfort zone to promote their profession. I think I'm so very excited about that day.
Yes, me too. And I'm so excited to come speak to the nurses in Manitoba, and also to play off the Not Just a Nurse Day that we did in October with the I Am a Nurse Day, because losing that just a nurse mentality is really the first step. If we stopped downplaying our brilliance and our contribution by sticking that just as a qualifier in front of us, we would start owning what we're capable of. And it's literally the first step, and it seems so small and what does my language really matter? But it is super impactful. And I think, as we start raising awareness and using the Year of the Nurse to really start having those discussions about what we want the future of nursing to look like. Everybody says they want to change, but what does that change actually look like? So I'm really excited to dive into some of those conversations and, use the knowledge and the brilliance that we have in nursing to get some of those solutions and ideas out there. In a perfect world, what would it look like? What are some innovative and creative ideas? Because within the nursing profession, we have those answers, and we just maybe don't know how to get them to the right tables. So I think it's going to be an exciting year to start pulling out some of those conversations.
Yeah, absolutely. For sure. As you say, we have a unique body of knowledge and skills that provide us with that broad perspective, a very holistic perspective of the clients and the patients and the individuals and families that we're dealing with. And that perspective is needed, especially when we think of the healthcare challenges related to chronic diseases, quality end-of-life care, effective use of resources. All that need the nursing voice there, both at the professional level and at the front line. That point of care nurse has much to share.
Mm-hmm. Yep, we all have a voice to contribute, and we all have that unique talent and brilliance to contribute, and it's really just about owning that and not being scared to share. So yeah, I think that's
exactly.
So, Mary, what suggestions would you have for a nurse who's looking to maybe get more involved in policy or advocacy work, whether in their local organization or in a professional association role? Any advice for nurses that are thinking that they might be interested in pursuing that type of role?
You bet. I think it first and foremost would be make sure that they're a member of their professional association. I think that's one of the first steps in involvement. And then getting on a committee. Mm-hmm. We have operational as well as board committees. That's a great way to share their knowledge and expertise from their perspective as a practicing nurse, and to learn from how a professional organization works. And, the looking into how the bylaws are developed and revised as things go. The fact that the board does strategic planning and works tirelessly to even come up with and develop a mission and vision and value statements. Those are all really important background and foundational work and information that will help. We are so keen when we have emails from nurses and say, I would like to get involved in the association. It's like a breath of fresh air when we see that, because associations as voluntary organizations are often very small staffed with limited resources. So we depend on that 360 feedback loop with our members, because we don't know it all. The membership has that knowledge. They guide the work that we do. So we need constant feedback loop with our members. And being an active participant on a committee is a great way. The other thing is keeping engaged and informed with the information that's on the website and the e-news, because there's often, whether it be highlights about trending topics, information to assist with their professional development, there's going to be something that will hopefully tweak their interest and want them to say, that's the area that I want to assist with. We are, as an association, connecting and partnering with our intersectoral partners, such as those working in poverty and homelessness. And we love it when our nurse members come on to volunteer to assist with some of the events we have in May 14th, during Nurses Week, actually, a service expo that will be focused on assisting those individuals who are experiencing homelessness in our community of Winnipeg here. And it's actually going to be held at the Convention Center, which tells you something, to say that there is a huge number of individuals and families that are experiencing this unfortunate situation. And it brings service providers together to show those individuals and can actually get service that day, because we know that some of the populations are not well engaged with services. There might be a fear from past experiences working with healthcare services and things like that. So I always say nurses need to be in the trenches, like look in the communities, identifying and increasing their knowledge about the environment from an acute care perspective, that they have an understanding of what those individuals are coming from and where they're going back to. Because without that, you really can't do effective discharge planning or effective care at all if there isn't that awareness. I also think just that increasing our knowledge and understanding of the importance of upstream work and moving. It's going to be a huge ship to move. We know that. And I think our government, with our shared health services transformation, is trying to turn that big ship around to recognize that investment and changing the way we do things is really important, because the only way we are going to control the rising costs of healthcare, particularly because of the chronic disease epidemic and things like that, is to really look upstream and build and support community resources. So, every nurse talking about that, every nurse talking to their patients so that they understand what role the nurse has to play in this work is really important.
I love that you mentioned that, because there isn't an area that nurses can't be involved in. Across the board, no matter what social justice or, health area, nursing can be involved in any and all of it. And I think it's really starting to show up at those tables and say, we have something different to offer and a different perspective to offer. And we think about things differently. And I think it's just starting to show up at those tables and not be scared to say that we're a nurse. I was reading an interesting article that as nurses move up through official management and leadership roles, especially once they're into government, that they shed the nurse title. And so they're losing, they step away from that nurse title. And I don't know why that's happening, but it's interesting because once you start digging around, nurses are everywhere and we're at every level of government and, decision-making tables. But there's this phenomenon where they're shifting away from identifying as a nurse. And so that's something I would really like to see us claim in 2020 is that nurses can be everywhere. And just because we're not point of care doesn't mean that we're not still doing nursing work, and to really help educate the public on how broad the nursing lens is and what we can contribute to many of those different areas.
Yeah, that's a really good point. And actually, one of the pillars of the Nursing Now campaign is to encourage every provincial government and federal to have a chief nursing officer embedded in the government so that they are assisting with that whole healthy public policy piece, so that every decision that government makes, regardless of what sector it's from, whether it's housing or roads and transportation and environment, as you say, we can have influence and impact in those areas. So that's really important, is one of the pillars that we provincially in Manitoba are talking about with our government, because we do not have a chief nursing officer. We have a chief medical officer of health, but we don't have a chief nursing officer. And there used to be, I think, back in the 80s. So, when cuts happen, unfortunately, cuts happen often at leadership and management levels so that dollars can be maintained at the point of care. I get that. But I think there's been some unintended outcomes because of that. Yeah. I think part of the concerns about safe, quality practice environments are that if you don't have that nursing leadership with that oversight, looking at the bigger picture and putting the pieces together, assisting and supporting nurses, coaching and mentoring, I really believe that we're seeing the consequences of that. We're currently in Manitoba partnering with Brandon University, who, when I was working there, we started a research project whereby we interviewed nurse managers, and it was like in rural RHAs, the stressors and the coping strategies. And the results that are coming out of that, and especially there was cuts at the time in the rural RHAs 12 years ago, and then consistently now, and there's going to be more again. It's quite alarming, and it's going to be a great opportunity for us to take the feedback from our nurse managers and bring it in a very collaborative way to government and say, here's evidence. Again, we talked about the importance of evidence, so that it's not just narrative, or even though evidence can be narrative and stories are very important, but clear evidence and research to support the need, so that those positions or that they look at areas to say, okay, where is the need for nursing leadership to be reestablished there? Because it's not just one puzzle piece. It's not just investing at one level of care. It has to be the full picture. So I would hope in this 2020 that one of the changes will be that we have a federal chief nursing officer, and that each province will as well. And I think that is going to build a very strong voice that will partner with or align with our National Canadian Nurses Association and the provincial associations, because there is so much work and so much benefit that nursing voice, again, that nursing knowledge and skills can bring to those decision-making tables.
Yeah, I agree. So Mary, just being mindful of time, I can't believe how fast this is gone. I'm just wondering, as a leader in the nursing profession, what change do you hope to impact? What would you like your legacy to be at the end of your nursing career?
That's a really good question. And I have a hard time with what would be my legacy, because I've always considered, I'm very much a part of a team, and it's not just me. Because when I come to work, I am nothing without the team that I work with, and as we've all found, right, in the work that we do. But because a passion of mine has been working in community, the community development principles of engagement with communities, that we get away from we are the nurse expert, and if we would just tell the patients and the individuals and families what to do, things will be great. But really, it's that need to work from a strength-based approach with in the care that we give to the individuals, that we focus upstream. We need to get upstream.
Yeah.
That this is the only way that we're going to contain those rising healthcare costs, is to prevent things in the first place.
Mm-hmm.
I've had a personal example, a health issue that came up about, and for me, it was, developed this autoimmune, and I had the experience of going through the healthcare system with it, and not one provider asked me about basically my lifestyle, like what did I eat, how was my sleep, whatever, but I was, put on medications and different things like that, and it was because luckily as nurses, we are critical thinkers, mm-hmm. and we have access to a great deal of information, which I love through CNA and through our association. I learned the importance of, anti-inflammatory diets and the importance of activity, the critical role that stress plays on autoimmune, like all of those things. And I think, my goodness, we're missing a huge opportunity. Those aren't hard questions to ask. No. To our clients. They really are part of our nursing assessment, right? Mm-hmm. But we kind of downplay them or don't see them as critical as like, what medications are you on? Yeah. It's an area that I would love to see promoted more. I think it's moving that way in our educational facilities. It's tough because there are so many skills now, and the technology of healthcare that has to be educated to our nurses, that they come out with that very much the science of nursing. Mm-hmm. And the other thing along with that is really stressing and getting back to the importance of the art of nursing, mm-hmm. that caring, the relationship building that is so vital. How we, as we talked about earlier, how we make people feel, how we motivate them to want to take responsibility for their own health, because they have to be active participants in their health journey. Otherwise, they're going to be passive participants, and they won't achieve mm-hmm. the health outcomes that could be theirs to help them have a great quality of life. So my passion is definitely one of that primary prevention as being the way to assist us in dealing with all of these challenges. We're always going to need acute, absolutely. But when you think of the years gone by, chronic disease and all that stuff, because of our age, mm-hmm. our death rates are older, not death rates, but we're living longer. Technology has helped us live longer and things like that, that we need to get back to prevention.
Yeah, I agree wholeheartedly. And, working in primary care myself, that is a struggle of, why are we putting more dollars into chronic disease management when we should be putting it into chronic disease prevention? Mm-hmm. Like, how do we stop mm-hmm. these things from actually starting? And it starts, mm-hmm. With maternal health and child health and healthy pregnancies and healthy deliveries and childhood and onwards and those coping mechanisms, because stress is such a key player in so many diseases, and we're not teaching people from an early age how to manage stress properly, and then mm-hmm. we're seeing these chronic diseases later on, right?
Exactly. That's right. And those supportive environments, so that it's making the healthy choice is the easy choice.
Yes.
Because right now in our environments, it's not.
Yeah.
Do we have safe playgrounds for like inner core parts of the cities and different things like that? Many of those areas within our downtown area don't even have like low cost grocery stores. That people are having to buy in these smaller stores and things like that. Like they call, that they talk about the food desert. Oh, there's so much that when we look at the social determinants of health, knowing that income and social status are the key indicator of somebody's health. Mm-hmm. It's not whether there's a bunch, MRIs or CAT scans kind of in the neighborhood. It's their income level and social status. So that's where we need to look at working together with those other sectors. We need to get rid of poverty. We need to abolish it in order to be able to move forward.
Yeah. And another thing I would love to see with the year of the nurse and the midwife is that instead of just looking, within ourselves, that we start looking up and out and start building some of
Mm-hmm.
those alliances with roles like teachers. My
Mm-hmm.
aunt is a
Absolutely.
teacher, and she's taught her grade 1, 2. She teaches grade 1, 2, 3 all together in a very small school. But she's taught them how to meditate, and that's how they start their mornings, is with 10 or
Oh,
15
that's
minutes of
amazing.
meditation. Right? Starting that at 6 years old is going to be so profound through that child's life that they have that ability. And so, reaching out and having those conversations and building those connections with different professions, I think, is what one of the things nursing needs to start looking at, is how do we start impacting health from all sorts of areas. But I'm getting off on a tangent.
That's such a good point. But I was going to say further to that is one of the things that we didn't touch on, which is the importance of self-care for nurses themselves, and trying to, even though in these really ever-changing, tough environments, taking that time for self-care, because that saying, we can't care for others if we're not caring for ourselves.
Mm-hmm.
And one of the things that I find so helpful is starting every day going to a yoga class. That's how I start my day. And if it wasn't for that, I don't think I'd be able to maintain the activity and stress level that I have in my job. But it's so important, and it provides perspective too.
Yes.
The importance of taking that time and one day at a time, or one task at a time, and the importance of breathing. How valuable that is.
Yes. Yes. And you're right. It's something as nurses, we're good at putting oxygen masks on everybody else, but not ourselves, to use that airline analogy. And I'm really happy to see that the Canadian Nurses Association, for their biannual conference this year, is all about nurses. And, they have a whole portion on kind of that self-care piece. So I think that's great that we're starting to have those conversations and really highlight the importance of it, because you can't care for others if you are depleted yourself. And we need to start owning that it's okay to take care of ourselves. It's okay to, have kindness and compassion and empathy for others and ourselves too. It doesn't have to be a me first thing, but simply like a me too thing. If I can give you time and space and energy, I can give that to myself too.
Yeah, that's so true. Yeah, I'm very excited about the biennial conference. I think it's going to be wonderful.
Yeah,
we're very lucky to have such an active, committed national association, and as a professional association, as being one of the jurisdictions, we certainly, it's a win-win, the relationship that we have. So it's great.
Yeah, I think it's so crucially important to have that. So Mary, as we wrap up, do you think you could provide the listeners today with 3 tangible takeaways or pieces of advice?
Okay. I love quotes, and I love finding little images and things like that. And when I thought about that question, I found a couple that I've used before and that I often refer to. And I think, and it speaks to some of the things we were discussing. And it's to allow yourself to be a beginner, because no one starts off being excellent.
Oh, I love
the whole idea about, taking that chance. Don't always wait till somebody taps you on the shoulder, but recognizing you wouldn't have graduated, you wouldn't have finished that program. Nursing is not an easy program. And remember the pride and sense of accomplishment that you have when you walked across that floor to get your diploma or degree or whatever. We need to go back to that, and to go to places that maybe scare you, remembering that the growth is waiting on the other side. Because to stay in a comfort zone, it is really easy to get stagnant, but pushing yourself and that's where that whole lifelong learning and making sure we maintain our competency is so important. And another statement is, great leaders don't set out to be a leader, they set out to make a difference. And it's never about the role, it's always about the goal. And I really thought that was so fitting to a lot of sort of the goals of the network, of what we're trying to do with the Nursing Now campaign and the year 2020, is recognizing everybody has a role to play. So it's not, don't sit back as a passive participant or passive observant to what's going on during the year 2020. go to something, get involved, get engaged, connect with the professional association or wherever you are, or your work site, you know. And we really hope that nurses will now say, I really want to go to work instead of I have to go to work. Mm-hmm. I think it really just even saying those words put a different perspective and a different lens on how your day is going to be.
Yeah, I totally agree. And one of the biggest mantras for 2020 is nurses that are feeling powerless or feeling that struggle at work or not sure how they can make change. The antidote to powerlessness is personal responsibility. So what can you control? How can you show up? What difference can you make?
Right.
And so I love those pieces of advice because I feel like that all ties in so well. So thank you so much for being here today, Mary. I appreciate you taking the time to share all your advice and perspectives. And just in closing, I would love for you to share a story from your nursing career that had an impact on you.
Oh boy, that is really tough because, you know, each kind of position or setting that I worked in was very impactful. But I think if I go back to working up in the north and having my first experience, and this, it's kind of funny because the highlight was it taught me that I had a lot to learn. So it's not one of those like, oh, I did really well, but it was where I tried to put together a prenatal class, and I didn't talk to the young moms first. I didn't do any of the things that you kind of thought what I've learned now with community development principles. And it was very, very challenging, and it was a little bit of a thought, but that probably stays with me in everything that I do. The importance of like, okay, I have a role to play. Like I can bring this, but what else do I need? What is the other pieces of the puzzle that need to come together to solve it? And it's usually like, what other people do I need to connect with? What other feedback? So that, you know, it probably isn't your typical highlight that you would hear about, but it probably was so impactful to me that I wanted to share that.
Thank you. And it's so true. You know, those stories that shape our learning and shape our careers maybe aren't always the ones where we did something really well, but what we took a learning from. And, you know, as nurses, we are never going to have perfect careers. We're going to make mistakes. We're humans. And it's how you learn from it and grow from it that truly makes a difference and can completely change the career trajectory you're on if you really own that and use it as a launch pad into the next thing and to do better next time. So that's great. Thank you.
Yeah. Thank you, Amy. I really appreciated this opportunity and look forward to seeing you in April.
Yes, I'm so excited. So for everybody listening, thank you very much for being with us. If you are a nurse in Manitoba, we are going to have the event on April 8th linked in the show notes for you to check out. And as well, we will make sure that we have all of Mary's information so that you can connect with her as well if you have any questions from any of her advice or insights from this interview. And as well, we'll make sure that the association page is linked as well for any Manitoba nurses that are interested in that. And, you know, if you're a nurse listening and you're interested in professional associations, just Google your province or state and there will be one for you to join. And I highly encourage everybody to get involved in their professional association because that is our voice at those bigger tables. And, you know, nothing's going to change if we don't start changing it. So I highly encourage everybody to get involved and start being an advocate for the differences they want to see made in nursing. So thank you, Mary. I appreciate you being here today, and everybody else have a great day. Bye.
Thanks, Amy.
Hi, nurses. I hope you enjoyed that episode of the Shift Change podcast. I want to take a moment and talk to you about something really important that's happening this year. As you probably know, World Health Organization designated 2020 as Year of the Nurse and Midwife. And while it's important to celebrate the nurses and participate in all these events that are happening, we need to make sure that we are being strategic about making this the year that we really use our collective voice to raise the profile and status of nurses and advance our profession. Understandably, some of you may feel resistance to this call to action. After all, How can we expect nurses to raise the profile and status of nurses and advance the profession when oftentimes nurses aren't even getting a proper break to sit down, eat something, or even use the bathroom on their shift? But you know what? If we don't act and act now, nothing will ever change. No one is coming to save the nursing profession from the burnout and exhaustion, from the staffing crises and nursing shortage, from the violence and bullying, from the budget cuts, and all the other threats to our profession that we are currently facing. Only we can save ourselves. And that can only happen when we decide enough is enough. We must decide that this is the year that we are going to use our collective voice to shout our value to the world, to introduce innovative and revolutionary ideas into healthcare, to advocate for our patients and our profession, to shed the just a nurse mentality and claim our position as leaders, and in doing so, change our profession. This year, 2020, Year of the Nurse and the Midwife, you get to decide. Is this the year that everything changes? Is this the year that we finally say enough is enough and break through the status quo? Is this the year that you, yes, each one of you, decide that you are tired of just complaining and actually put in the work to make a change? Because the truth is, it is up to us. And nothing changes if no one changes. Let me say that again. Nothing changes if no one changes. There is a movement happening and it needs you. We are stronger together. Come join us as we disrupt the status quo and evolve our profession. It's time. It's our time. We're stronger together, so let's get started. If you want to know how you can join the movement of change, visit nurseleaders.ca/2020nurse to opt in for a free 3-part video series about how we can use 2020, the year of the nurse and midwife, as the year we use our collective voice and lead our profession forward. So jump on over to nurseleaders.ca/2020nurse for all the details. I'll see you over there.